Yeah, I can see it.
A protein metabolism 2. Can you be able to see it?
Yes, I can see it.
Is everybody able to see this?
Yeah, we can all see.
Can you respond, please? I have protein metabolism 2, protein energy malnutrition. Can you see it?
Yes.
You can.
Yeah.
So now we start talking about a much more frequent problem that you may meet in your medical practice as you come into practice. I also have objectives for this, and the objectives here will be in the beginning, or when you finish this talk, you should be able to highlight the health burdens associated with malnutrition globally. You should be able to define malnutrition, explain the body's response to malnutrition, enumerate the etiological factors that account for malnutrition, describe the classification of malnutrition, and you will be able to discuss a few clinical forms of malnutrition. So at the end of this talk, this is what I expect you to do. Oh, the burden. Malnutrition is a big burden. More than 3.5 million mothers and children die every year due to an underlying cause of malnutrition. Malnutrition being defined here as low nutrition, undernutrition. To more than 55 million people, about 10% of the children are wasted globally. We have more than 19 million people who are very severely wasted. Severely wasted meaning severely malnourished. A World Health survey, a World Health Organization survey, a recent one, indicates that about 40% of preschool children under the age of 5 are underweight. Okay, so malnutrition is a major global problem. So what is malnutrition? How does malnutrition occur? Malnutrition occurs as extremes of nutritional spectrum. We have obesity as a malnutrition in which there is excess of nutrients in a particular individual. And we have undernutrition, which is the other extreme, in which there is a deficiency of nutrients in an individual. So this spectrum ranges between, so in between here, they are low nourished, averagely nourished, properly nourished, and extreme overnourished, and extreme undernourished. So the extremes of malnutritional spectrum. So in the under fives, malnutrition is the most common or the most important cause of illness or cause of death. So the commonest or the most important cause of death in the under fives is malnutrition. In these under fives, about 55% of the deaths are due to malnutrition. The other causes in the under fives are diarrhea and acute respiratory illnesses, perinatal illnesses which occur during delivery or around delivery. The others, other causes of death account for 32%, while measles and malaria are now just mild causes of death. So malnutrition is a major problem in the under fives. And this is just the same thing as the previous slide, only given in a diagrammatic presentation. So malaria and marasmus account for very little of, so very small amounts of causes of death in the under fives. Okay? The main cause of death in the under fives, 55%, is malnutrition. So what is it? What is malnutrition? Malnutrition derives from the etymological origins that malus meaning bad and nutrire meaning nourish. It conveys and denotes the sense of improper nutritional status. That means the individual is outside the norm of health boundaries. Okay, health boundaries are between average nutrition and the proper nutrition. And the extreme of nutrition are those ones. So malnutrition is either the undernutrition is the deficiency of one or more nutrients, essential nutrients, or the overnutrition side, the person has an excess of the nutrients, of one or more nutrients. Okay, so over malnutrition is an excess of or lack of. The normal nutritional requirements are macronutrients, and macronutrients are carbohydrates, lipids, and proteins. Water is a universal nutrient. It's either macro or micro. And these are needed for energy, cell multiplication, and repair. Micronutrients are trace elements and vitamins and nutrients, and they are essential for metabolic processes. The World Health Organization defines malnutrition as the cellular imbalance between the supply of nutrients and the energy that the bodies demand for them to ensure growth, maintenance, and specific functions. The cellular imbalance between the supply of nutrients and energy and the body's demand for them to ensure ensure growth, maintenance, and specific functions. So loosely defined, the term malnutrition commonly is used as an alternative to undernutrition, but technically it also refers to overnutrition. So anytime you talk about malnutrition, people think of undernutrition. So people are malnourished if the diet doesn't provide adequate calories and protein for growth and maintenance. Okay? This is irrespective of whether you have too much or too little. The body isn't taking from the pool whatever it needs for its normal sustenance. People who are malnourished, if they are unable to fully utilize the food they eat due to illness. So it doesn't have to be lack of nutrition, the nutrient. It is also lack of utilization. It may be there, but you're not using it. So people are also malnourished if they consume too many calories, too many for what they need. So what is the body's response to malnutrition? The body's response to malnutrition is a starvation thing. So it's a response to starvation. Adaptation to starvation requires that alternative sources of energy be recognized and deployed. So malnutrition now dictates that the body uses the other sources of the nutrients for its utilization. So depletion of glycogen stores initiates an increase in gluconeogenesis, with this results in increase in glucose and reduced insulin. Okay? So when we deplete glycogen, the body now has to make new glucose. So the process utilizes glycerol. So this process now uses other things in the body, amino acids, lactate, and pyruvate. So when we are carbohydrate deficient, the body makes carbohydrate for you from other sources. And this means that these other building blocks must be provided. And provided for fatty acids, we have to fatty acids must be, are you still seeing the slides? Hello?
Yeah, we can see them.
You're still there? So
Yeah.
fatty acids and ketone bodies are broken down through fatty acids. So carbohydrate deficiency means that the fats that are around must be mobilized. So we get to the alternative of getting fat from the fatty acid sources. So reduced protein in catabolism and gluconeogenesis. So the body adopts by changing its target sources of the required nutrients. So that's the adaptative. So in the same adaptation to fluid and electrolyte, we increase, so we induce inhibition of pumps that are commonly used in the body. So we increase intracellular sodium, which is rarely the case. We increase total body water. We increase urinary loss of potassium, calcium, and phosphate. So the body tends to excrete the unrequired minerals. So there is reduction in total body potassium, and this may lead to hypotonia, apathy, and impaired cardiac function. So this malnourished fellow adapts by changing their target source of energy or source of nutrients, and it leads them to be weak and have impaired functions of particular organs. So these are the adaptive responses of the body to lack of nutrients. What are the causes? The causes can be primary, and primary, particularly in children, is failure of lactation or failure of provision of milk from the mother. And this may be due to ignorance, and sometimes it is due to, most of the times it's due to poverty, okay? Ignorance of the weaning time by the mothers. There may also be cultural patterns and food forbidding activities. Lack of immunization and primary care, or lack of family planning. These are the main etiological factors that occur in malnutrition. Notice that I'm talking about children. It is rare to find malnutrition in adulthood, except in the extremes of age. So in the old age and the young age is where malnutrition is a problem. So there are also secondary causes of malnutrition. Secondary causes may be due to infections, infestations by parasitic worms, infections like measles, whooping cough, and primary tuberculosis, or urinary tract infection. It may also be secondary to congenital heart diseases and urinary tract anomalies, giardiasis, lactose intolerance, celiac disease, tuberculosis, and cystic fibrosis. And then the inborn errors of metabolism, particularly those of glucose, like galactosemia. How do we classify malnutrition? Malnutrition can be classified in 6 ways. So you pick one of them. And of these 6, we have the World Health classification, the Gomez classification, modified Gomez, and modified Gomez is slightly different from the original Gomez. And then we have the Waterlow, we have Wellcome, and we have the Harvard classifications. You pick one which you're comfortable with and use that one to classify your malnourished child. The World Health Organization defines the presence of edema on both feet as an essential feature. And of these children, 70% of weight for length or less than 3 standard deviation and clinical sign are defined as malnourished. So children who have 70% weight for height deficiency, or 3 standard deviations from the normal and with clinical features are defined as malnourished. So the World Health Organization gives you a freedom to choose which classification you want. You can go for edema and weight, or the standard deviation from the normal curves. The Gomez one defines weight. If weight is greater than 90% of the expected weight, this is normal person. Greater than 90% of the expected weight for that individual. That individual should be derived from a chart. If the first degree is given when the weight is between 75 and 90% of the expected weight for that individual. And this is usually obtained from a standard chart. The second degree, so the Gomez type goes by degree, and this is 60 to 70% expected weight, and less than 60% of the expected weight is third degree. So Gomez is a rough estimation, and if it doesn't consider height, so weight for height is probably superior to this Gomez type. The modified Gomez is if weight is greater than 80% of the expected. So they have modified it by lowering the upper, so the expected limit for no nutrition. So they have allowed for more people to be nourished, well nourished. Okay? The second is only 70 to 80%. So it's just the figures that have been changed. Waterlow one is a classification system in which they are classifying protein energy malnutrition based on wasting, the percentage of expected weight for height, and the degree of stunting, the percentage of height for age. So height for age and weight for height. Okay, so we have two parameters in the Waterlow, and the Waterlow chart is like this. We have height for age and weight for age. Okay, so if height for age is less than 90% and weight for age less than 80%, that is called chronic malnutrition. And if weight for age is less than 90% and weight for age is less than is between 80 to 120, then this fellow is stunted or malnourished. If weight for age expressed as a percentage is greater than 120 and height for age is less than 90, this fellow is obese or stunted and obese rather. So stunted and obese, we have weight for age expressed as a percentage but greater than 20. So chronic malnutrition, stunted with no malnutrition, and the one who is stunted with obesity, and those ones. So this classification also says that when height for age is greater than 90 and weight for age is less than 80, this is an acute malnutrition. A normal individual has height for age greater than 90, weight for age between 80 and 120. An obese person has greater than 90 and greater than 120. So this is a Waterlow type of malnutrition, of classification. So the Wellcome is a system for classifying protein energy malnutrition in children based on percentage of expected weight for age in the presence or absence of edema. So Wellcome is like the World Health Organization. So Wellcome now says underweight is between 60 to 80 of expected weight in the absence of edema. So Wellcome is the one that we standardly use. So between 60 to 80, in the absence of edema. Kwashiorkor is between 60 to 80 and has edema. And marasmus is under 60% of expected weight for age, and there's no edema. Now, when we have less than 60% weight for age and we have edema, we have a condition we call marasmic kwash. This is the one that is commonly used. The Harvard classification is one which uses the chart, growth charts, and growth charts classify people into percentiles. 50th percentile is called a normal child. Grade 1 is one which falls, so if a child, the weight is 50th is between 70 to 80% of the 50th percentile. So 50th percentile is that average individual. So any particular age, you get a 50th percentile for it, and you can compare your child to that particular age in this Harvard system. I have paused so that you can ask a question here, because I'm not going to answer questions at the end. Are you still with me? Hello?
Yeah, we can still hear you.
You can see my slide too.
Yeah, we can. It would be good if you can present it.
What slide are we on now?
The general classification.
I've lost it again. Your general classification of malnutrition. So when you get to practice medicine, you will be able to classify malnutrition according to you. And your main target will be the arm circumference. And this will be measured using a tape. So you don't have to go into the charts. At the age of 12 months, the arm circumference is roughly 16.5 centimeters. Okay? So between 12 and 24 months, it is between 12.5 and 16.5. Okay? So the cutoff is 75% of the expected arm circumference. So if we take 16.5, this fellow will have less than 14 centimeters for them to be malnourished. Okay, so this will be your general way of classifying your children if you don't have the charts and the like. So there are a number of clinical forms of malnutrition that we're going to talk about, but mainly I'm going to address the clinical malnutritions that we see in childhood. And here, the acute forms are of three kinds. We have the marasmus, which is severe loss of weight or wasting. And we have kwashiorkor, which is a bloated appearance due to water retention. So this fellow may not appear malnourished because they have fluid retained. And the third one is a combination of wasting and edema. So wasting and edema is marasmic kwashiorkor. So marasmus, severe weight loss, and kwashiorkor is a fellow who is bloated. They may even be heavier for their weight or their height or their age, but they will be having poor protein in circulation. Marasmus is a rapid deterioration in nutritional status in a short period of time. This is an acute form of malnutrition. And this may lead to, so this is the one common form of malnutrition. It is the most common form of acute malnutrition and causing nutritional emergencies. and its severe form can very quickly lead to death if not treated. So wasting can affect the children and even adults. So marasmus can occur in childhood or in adults, okay? A majority of times, it is characterized by severe wasting of fat and muscle. The child has good appetite. They have normal skin. They appear like the appearance is of monkey face and little old man. Or they have alert faces. They are looking alert, but they are not able to reach out for food. The children at risk the children are at risk of having hypoglycemia, hypothermia, fluid overload, heart failure. Infection is what normally brings these children to you. A wasted child can be classified as either moderately or severely acutely malnourished, depending on the measurements. This is marasmic child. Kwashiorkor is characterized by bilateral pitting lower leg edema and feet which as it progresses becomes more generalized, and the body and arms get edema. So edema is the excessive accumulation of fluid in the body tissues which results from severe nutritional deficiencies. All cases of kwashiorkor are classified as severe acute malnutrition. So kwashiorkor is classified by the severity of the edema as followed. Mild kwashiorkor, both feet. Plus both feet. So plus, moderate kwashiorkor, both feet and lower limbs and hands and arms. So severe is generalized edema, including both feet, legs, and arms, and even face. So generalized edema of the body. So clinically, these people have poor appetite, and they are anorexic. They have flaky paint dermatitis, they have ulcers, they have hypo or hyperpigmentation, they are miserable looking and apathetic. Liver enlargement may occur in these people, marasmus. You're in kwashiorkor. This is kwashiorkor. The other extreme of the malnutrition is obesity, defined as excessive adipose tissue that imparts health risk. The etiology is common, genetic predisposition. So you find obese child in an obese group or obese parents. So that largely derived from carbohydrates and fats than in proteins. Diseases, pre-existing diseases like hypothyroidism, Cushing syndrome, insulinomas, and hypothalamic disorders are frequent associations with obesity. So obesity can be found with these diseases. Obesity is associated with increased adipose stores in the subcutaneous tissue, skeletal muscles, internal organs, such as kidneys, heart, liver. Fatty liver is also more common in obese individuals. There is an increase in both size and number of adipocytes, and there is hypertrophy as well as hyperplasia of the body. Changes that occur in obesity include hyperinsulinemia, non-insulin dependent diabetes, hypertension, hyperlipoproteinemia, atherosclerosis, coronary heart disease, cholecystitis, cancer, and osteoarthritis. These are common complications of obesity. Serious health hazards can occur in obesity, stroke, coronary heart diseases, hypertension, fatty liver, diabetes, atherosclerosis, hyperlipidemia, osteoarthritis are severe, serious health hazards. How do you now manage obesity? Nutritional therapy, behavior modification, and support groups. So medical management is drug therapy, appetite suppressing drugs, so they don't work. Surgical removal of vertical bands that are in the stomach. They're called gastroplasty or adjustable gastric banding. So we reduce absorptive surfaces so that nutrients do not get in excessive of what is required. These are obese people. These two people are the same. The laboratory evaluation of malnutrition. A full hemogram usually gives you an underlying illness. Blood glucose gives you an underlying metabolic cause. Septic screening gives you a possible infection, stool or parasites, calcium sensitivity, fat globules, and malabsorption screening. Urine microscopy, electrolytes, these are all indicated or required in screening malnutrition. A chest X-ray and a Mantoux test. And now we exclude HIV, and currently maybe you will exclude corona. Complications of obesity include hypoglycemia, hypothermia, hypokalemia, hyponatremia, heart failure, dehydration,